What community you live in?
Yes, I'm Joyce England. I live in Charlottetown, and I represent the PEI Midwives Association. And I've just returned from the Canadian Association of Midwives annual conference, where I learned that in Ontario, 14% of pregnant women are now delivering their babies into midwives' hands. Our question is, when will women in PEI have the option of a Health PEI funded midwife for their pregnancy, birth, and postpartum care?
The decision to expand services is a responsibility of the Department of Health and Wellness, and it sounds like I'm passing the buck, but I'm not. But it's the way the structure is set up and the responsibility is set up, because it requires funding and it requires legislative changes and those types of things. So that responsibility ultimately will rest with them. One of the challenges we have, because of the size of our province, and Dr. Wedge could speak to this a little better than I could, is with 144,000 people and the requirements around, and the current numbers of obstetricians and gynecologists, as well as family physicians that practice in these areas, how you create the volume and the resources you need to be able to support, continue expanding that role. Because one of the challenges we have as a system is making sure people have enough of a experience with various types of care that they keep their skills up. And we have maybe about 1,700 births a year roughly in the province here, something in that range. So it's a bit of a challenge for us to manage that. That's not to say the commitment's not there to look at it, because that has been talked about, but it really, there's a number of things that would have to get worked through as they investigate that opportunity to expand that service.
Thank you. Dr. Turnbull can speak to that in Ontario.
It's true that we have midwives, and in fact we find that the midwives are actually moving into our tertiary care hospitals, because I now have 6 on the medical staff, and so they're not necessarily confined to community deliveries of well babies, and so they're playing their role. I think across the country, I think we're struggling with scopes of practice in many different areas of midwives, the role of physician assistants and nurse practitioners and the likes. My way of thinking about that is that this requires dialogue. There is so much work to do and so few providers. I think we just have to be thoughtful and integrated in the way we deliver those services and break down a lot of those boundaries. And we're starting to see that in team-based care, which has turned out to be enormously positive experience for all providers, and I would hope that we would be able to continue to work through those initiatives in every jurisdiction.
Thank you.